Things to consider when you're deciding which piercing to get done next. Coming up next on Body Piercing Basics, episode number 108. So you might want to stick around. For those who are new to the channel, first off, welcome to the channel. Hope you're enjoying it. Hope you're finding it informational, and I hope you're enjoying my magic hands and my oversized t-shirt. But you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So, when I talk to you about these things, I'm talking to a level of expertise that comes from me in the body piercing industry for well over, in this case, 26 years, soon to be 27. What we're going to do today is I'm going to cover some of the things that I think that people should consider before getting a piercing done. This is a lot of it's some stuff that most people don't even think about. I think it will help. I think it'll be helpful when you're kind of making that final decision on what your next piercing is going to be. It's probably one of the most common questions I get is whether I should get this piercing or that piercing, this versus that, etc. And I hope this will give you kind of a toolbox to kind of make that decision based on some things I think that are very important. First off, desire versus commitment. The thing is, with any piercing, we have the desire to get it done. No way around it. You really want to consider with desire is how it's going to look on you and whether or not it's something that you can live with for the rest of your life. As far as the commitment, of course, you're going to have this piercing for a long period of time, hopefully. And even if you don't, there's going to be scarring. So you need to consider that beforehand, what those long-term effects are going to be. Also, are you willing to take care of the piercing? In some cases, piercings can take a really long time to heal, sometimes up to a year or longer in some cases. It's not something you can take care of for a couple of weeks and then go, I don't want to take care of it anymore, and not expect to see problems. The other thing is, are you willing to wear jewelry that's maybe not exactly what you want? In some cases, with various different piercings, we need to start out with something very basic, very plain, very ordinary, and often a little too big for what is needed. So in those cases, are you willing to put up with wearing that jewelry that's maybe not as beautiful as what you really want until the piercing is healed? Anatomy. There are piercings that you either have the anatomy where it's going to work or you don't have the anatomy, and it's not going to work. I just did a video, I believe last week, that covers some of this. I would suggest checking it out. I'll put a card up with a link for that. Now, the thing with this is if you don't have the correct anatomy, it's kind of hard for you to just go, I have the right anatomy. And that's a pretty common thing I get. People send me photos and everything else. Can I do this piercing? The reality is, until you sit down with your piercer and they're taking a look and evaluating your anatomy, it's really difficult to say one way or another. We can describe it to a point, but at some point, you really have to have the hands-on to go, yeah, it's going to be a great experience, or no, that's not, you're not right for it. Now, so the thing you would ask when picking out a piercing is, does this piercing rely heavily on you having the correct anatomy? The other thing is if that's the case, what is your second choice? It's a good idea that when you're setting an appointment or thinking about getting a piercing done, that you set up a second possibility just in case that one doesn't work out when it's a piercing that really relies on your anatomy. And things like tongue piercings, etc. Really, there's no choice in the matter. You either can do it or you can't do it. The next thing you want to think about is how difficult this piercing is going to be to heal. Do your research. Some piercings are fairly easy to heal. Other ones can be very, very difficult. And sometimes we try to talk about this to a degree during the consultation, but sometimes it doesn't really register with people. They're excited. They want to get any piercing. Damn to any information I might be throwing at them. Really do your research on this. There are certain piercings that are just more difficult to heal. For example, a lower lobe might be a hell of a lot easier to heal than an upper ear cartilage piercing. A lot of things contribute to that. It's the amount of contact it gets. It's the blood flow to the area, and etc. That are going to make one more difficult than the other. Piercings that involve one piece of jewelry through multiple piercings, like industrials, are going to be much more difficult to heal than just a single piercing. So you should really consider that. The other thing is this piercing prone to issues? Some piercings have a reputation of being more difficult to heal than other ones, or more prone to scarring, or more prone to this, or more prone to that. Do that research and find out. Ask that question during the consultation. Last one is, does this piercing require extra care? I'm going to be getting into the lifestyle changes next, but a lot of it is that. Is it going to affect whether or not you can wear certain headgear? Is it going to affect whether or not you can exercise? Is it going to affect things in your daily life that are important to you? You should know these things in advance so that you can make an educated decision. Or pick a piercing that doesn't as much, or doesn't impact your daily activities as much. Next thing you want to consider is lifestyle changes. Now, a piercing, depending on where it's at, depending on what it is, can affect things like your diet, clothing, intimacy with your partner, sleeping, swimming, and, of course, interaction with your pets. All these things need to be considered before you're choosing. Some piercings, like, for example, a ear piercing, is not going to affect your diet the way that a tongue piercing is going to. You should know these things and consider these things beforehand so that you know what you're getting yourself into. Ask questions about this. Another example is if you're a side sleeper, you may have less problems healing out a nostril piercing on the opposite side than you would an ear piercing. It really is some things you want to consider that you're going to have to change your life, at least for a short period of time, to heal this piercing out correctly. The next one I'm going to talk about is employment and events. With employment, you really want to talk to those in charge or read the manual and find out what's acceptable and what's not acceptable. Are you going to be required to keep it hidden while you're at work? Is that even possible? How is that hiding it or wearing a retainer or what have you going to affect the overall healing process? Things you need to talk to your piercer about. Is the piercing considered unprofessional? Meaning, in your particular line of work, are they going to accept that piercing, or is it something they're going to go, no, you can't have that? It's going to affect whether or not you're going to see advancement in your job, etc. So you really want to consider that beforehand. The next thing is how noticeable will the scarring be if you decide to abandon the piercing? If her work says, nope, you can't have it, how much scarring are you going to see, depending on how far you're in the healing process? I know everybody thinks that piercings are just temporary. You take the jewelry out, everything goes back to normal, nobody ever bothers you again. The reality is there are some piercings that will leave indentation scars that are very noticeable, especially on the face, around the eye, on the nose, and around the mouth. So you really need to consider if that's going to affect your future employment, etc. The next thing is events. Events, I don't know how many times I have somebody come in and they're like, I want to get this done. I want it just in time for a wedding or a prom or a vacation or being at the beach or something. Usually this is probably not a good idea. In many cases, the piercing's not going to be healed enough that it's going to look good. And if you're taking wedding photos, you may not want a healing, but not exactly healed nostril piercing in your wedding photos with a little bit of discharge on it and looking a little red because it's been one of those days. The same goes for, the most common thing is I'm leaving on vacation and I want to wear my navel piercing at the beach. No, you don't. Not only is it not going to be healing, but it's going to be healing and you can't swim, but it's not going to look great. It's not going to look, it's going to look a lot better once it heals. The other thing to consider with this is longer jewelry needs to be put in some cases to allow for swelling and other problems. So it may not look great when you go to this event because you have this huge piece of jewelry in there. Now, medical procedures. If you have any pre-existing conditions that may affect medical in general, it may affect healing, you really need to talk to your doctor beforehand. In some cases, easier heals are going to be a better option for you. Like, for example, if you came in and you said you were diabetic and you're deciding between having an upper ear cartilage piercing done or a lobe, I'm going to probably say, let's do the lobe, mainly because better blood flow, less likely for issues, not as difficult to heal. The next thing you want to worry about is any type of medical procedures that you have coming up. If you have elective surgery, if you're going in for an exam that's going to involve scans of any type, you should consider whether or not the piercing is going to be healed in time that you can remove the jewelry for a short period of time or put retainers in. The other thing is you may want to talk to either the doctor or technician to find out whether or not you're going to be allowed to even wear the jewelry during the procedure. Glass is a great option because you can pretty much put it in. It's not going to have any problems or issues, but it's best to know these things beforehand. Nothing sucks more than having to remove a piece of jewelry from a healing piercing for a couple hours for a procedure and then trying to get it back in and realizing that you're going to have to re-pierce it all over again. Next one is sports and organized activities. If you're involved in any type of sporting event that involves any type of organizations, chances are they have some kind of limitation or discretion as far as wearing jewelry while you compete. Now, this varies greatly from organization to organization. Whether or not it's needed or not is another thing, or a safety issue or everything else they claim. The thing is, you need to do your research and find out if this is going to affect whether or not you can compete or not, or even practice in some cases. The next thing with sports and other activities is anything you wear in the process of it, is it going to have contact with the piercing? Is it going to need to be cleaned on a regular basis? Is it going to cause constriction that may lead to issues, abuse, etc.? You need to think about these beforehand. If you ride a motorcycle, how is that ear piercing going to feel inside that helmet? Are you going to be able to take the helmet off and on comfortably without having issues? Think about the stuff beforehand. You might want to decide to choose something else because it's not going to have that contact with the helmet, and do that piercing that's going to later on down the road. The other thing is, if you're involved in something that's just going to require you to take it out. For example, if you're in a play, your nostril piercing in a play set in the 1930s is going to stick out like a sore thumb. So you want to consider that beforehand, whether or not a retainer is possible, or if it's going to be a situation where you might want to wait until afterwards to get that nostril piercing done. Now let's talk about something I get a really common question. It's usually after the fact. Exercise in hobbies. With exercise, most cases, piercings aren't affected in any way, shape, or form. In fact, it's best that you are healthy. And if exercise is part of keeping you healthy, then it's a good thing. We're going to be proactive with that and say that's great. Certain movements don't feel great at first, but over time, you won't even notice the piercing is there. However, you're going to have to be extra diligent to avoid contact and trauma to the piercing, even after it heals. And you're going to have to be extra diligent about taking extra steps to make sure that anything that piercing comes in contact with is cleaned on a regular basis. That may sound like a small commitment, but when you really start to think about it, especially if you go to a gym, how much contact that piercing possibly has with equipment, towels, etc., it gets a little bit more complicated. And it's not something you can do for a couple weeks and then go, it's fine. And then start not doing it. It is something you need to do religiously. And the last one, and this one's kind of a specialized thing, how it's going to impact other people in your life. When you're thinking about this, if they are very aggressive, very out there, extreme piercings, especially facial piercings, etc., how is it going to affect when you're out with your friends and family? How will they interact with people that react poorly to you? This may seem kind of weird, and me going, oh, Grandpa's saying this, but the reality is I've noticed it in my life. I don't notice it anymore. But everybody I hang out with, my friends, family, if they're not modified, they notice it immediately. And they get a little offended by it. And they can get a little aggressive about it. The other thing of how it's going to affect is if you're getting a piercing done that would be sexual in nature. How is that going to impact your partner? Now, it is your body. You have complete control over it. And if you decide to get pierced, that's your decision. However, you should discuss it if you're with a partner long term. They should have some kind of input on this because it's going to affect their life also. Well, that's all I have to say on this subject. If you liked this, enjoyed it, found it educational, what have you, give me a thumbs up. Let me know that you liked it because we like it when you like it. If you haven't already, please subscribe, hit that notification bell so that you're notified every single time we post a video. If you like merch, you like swag, you like t-shirts, etc., check out our merch store. Link is in the description. There's also one of those merch bars down there. If you're in the Des Moines, Iowa area, I am now selling I'm pierced, but I'm not telling you where t-shirts. You can pick those up right here in the studio. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care. Stay well. And we'll see you in the next video.